Good afternoon, good evening, everyone, wherever you're joining us from today. We want to welcome you to the Nurse Policy Entrepreneur Cafe. We believe that nurses are well positioned to incorporate health in all policies because we're the first witnesses to all of the determinants of health, and we keenly understand that health system strengthening expands beyond traditional direct care roles. Nurses work in multiple spheres of influence to shape health and social policy that addresses problems in healthcare, including in the workspace, in government, associations, and in civil society at large. The origin of the word entrepreneur comes from the French language that denotes a person who undertakes a project. So this doesn't necessarily mean business entrepreneurship. This concept is not unfamiliar to nursing professionals, and societal changes have been initiated by individuals who have observed a problem and figured out how to disrupt the status quo and the equilibrium to improve something. And policy does not always mean politics, and deriving effective change does not always mean running for office to do so. A policy is just a set of ideas or a plan of what to do in a particular situation. The Future of Nursing report has a multidisciplinary call to action for nurses to assume leadership positions and serve as full partners in healthcare reform, from practice to policy, including in decision-making for national policy. And nurses must prepare to engage regardless of our practice settings. Nurses, as the largest constituent profession, have maintained our status as the most trusted profession for decades, yet we're rarely engaged in the process of healthcare policy making. The concept of nurse policy entrepreneurs, while it's been practiced for centuries, is often overlooked, and this gap is not only from our invitation, but also our struggle to identify as thought leaders in this arena. So, becoming engaged as a thought leader and policy influencer is an element of our professional identity, with the beauty of diversity in our individual perspectives, personalities, and leadership roles. If we leave it to other disciplines to determine healthcare policy, whether they are healthcare providers or not, reform will be marginalized. We must become known as more than just the trusted profession, but also as the most influential when it comes to policy, because we have the highest touch points in healthcare. So, how do we address these issues? As the complexity of policy increases, a higher degree of expertise and skill sets become more important. It becomes harder for individuals to influence policy. But if we foster dialogue, inclusivity, innovative thinking, we can better understand how to engage. Our methods here at the NPE Cafe are based on theory to address the gaps between ideation and action. We promote diverse insights for meaningful evolution. We use Parsi's human becoming community model to describe how the concepts of co-creation lead to community building and evolution. And the World Cafe method is the gold standard that establishes a psychologically safe environment for collaborative innovation and shared learning. There are three change concepts that might seem paradoxical at first, but they really complement discussions and shared learning. This includes moving and initiating. Think of how we shift between somewhat chaotic discarding and creating of new ideas and meaning as a result of these conversations with others. And then we have anchoring and shifting. So recognizing that when an idea improves your previous thoughts and shifting them after this contemplation, or anchoring further down in your previous thoughts and making them stronger as a result. And another one is pondering and shaping, so dialoguing and then meaningfully listening to complete thoughts of others. This is the basis of our cafe that we host once monthly. We have no affiliations, no paid membership, no eligibility criteria that prevents getting engaged, no barriers, and no borders, because nurses need an organized process to meet, network, and discuss approaching these issues, not debating our stances on them. In holding this space, we create structural empowerment for nurses to become effective policy makers and implementers, while simultaneously exploring how to create a system for true deep democracy at all levels to improve our communities. It breaks down imposter syndrome because by facilitating this evolution and guiding nurses through group mentorship to resources and inviting them to be active, you embody what you believe to advocate in new ways. We are open to all nurses and students at all levels and in all settings across the world. Now, you can start with your own preparation. You can clarify your why, your reason, your purpose, how you got into nursing in the first place, and continue to develop an expertise beyond your clinical expertise within hospital walls. Create a personal professional development plan. Find organizations that share your why, share your values, and join them, and be able to engage with them, developing your social and political network. And by just practicing reading, writing, and speaking as much as possible about this to develop your expertise and become that subject matter expert. Then you can take a deep dive into our skill sets. We've organized a living and evolving list of essential skill sets that one might need to develop all or part of their professional expertise and their identity as an NPE across the career continuum, which can change. Your needs can change as you grow. And you might organize these a little bit differently, or you might share something that you think we're missing in them. And now we do have some netiquette that we follow. It's very simple because we believe in open access to these resources. We do record these sessions so that our community members across the globe who cannot always join synchronously each month can access this information. When we have a speaker, we get their consent to share this and have first rights to edits before we have our Zoom session. To maintain our psychologically safe space, we do not share the discussion that follows. There might be occasionally really robust Q&A afterwards that really adds to the month session and the discussion and conversation, but we carefully either edit this and include it without sharing the community member's name or face or voice, or if that's not possible, we ask for consent to do so before posting it on our website or YouTube. If you want to completely make sure that you avoid any type of this inclusion, feel free. Leave your camera off, stay on mute, and you can engage with us in the chat, which we never share. So here's some of the resources that we regularly share our material on. The online process includes a one-on-one navigation guidance for newcomers to our cafe and community. We onboard them to theoretical foundations, as well as the resources that we've developed so far, and the process for our monthly cafes. We have resources that are collectively aggregated in a multimodal repository for adult learning and various styles of learning. We have a modest website. It does serve as our centralized source for these efforts. These resources are infographics, we have roadmaps, educational content, links to springboard you to other resources that already exist out there that we don't need to recreate. We just kind of curate them for you. And our monthly Zoom Cafe sessions have evolved to highlight a speaker organized with this skill set so that we focus on every component of them as much as possible in a know one, see one, do one modeling. And we share this experience from nurses to nurses, and we share our dialogue about it. The implications are just that, at the very least, you as a nurse policy entrepreneur walk away from each cafe with a little bit more understanding about steps you can take to make an impact. We seek to empower nurses as influential advocates and full partners in healthcare reform, translating advocacy to policy. After dialoguing in our open door, judgment-free space, using our resources, and diving deeper into your why, we as nurses can build upon our practice of advocacy out in the world and in broader engagement. So let's get started. And today, I am so very, very excited to introduce to you Professor Giselle Gerardi and also an instructional designer, Jessica Packer, who joined us from Stony Brook University. I will let them introduce themselves. They are amazing colleagues and professionals who are going to talk to us about some policy, healthy policy that is hidden in plain sight.
Thank you so much for that great introduction. I just love the way you start this cafe. It just sets a really great tone. I'm Dr. Giselle Gerardi. I teach health policy at the graduate level at Stony Brook. I'm a clinical assistant professor, and I also do research in health promotion, disease prevention, especially in minority populations.
And hi, I'm Jessica Packer. I'm an instructional designer now. I actually used to be a high school English teacher, and I am not a nurse, obviously, but way back when I was an EMT for a while in college. So that's about as close to the nursing situation as I'll get. But I'm very excited to be here. So thank you for having us.
Yes, definitely. And I think after working with she's not just working with me, but a few other nurses. She'll be an honorary nurse just by working on all of our courses. So again, thank you for joining us. This is our presentation, and we're just going to start off quick with a little background that I think everybody in this group can agree on, and it's pretty familiar. So next slide. Yeah, so health policies, nursing work. I'm preaching to the choir when I say that to this group, I'm sure. But just some examples. AACN Essentials, for those of you who are not in academia or not familiar, the essentials outline the curriculum and the competencies that nursing students from baccalaureate all the way through DMP levels should have when they graduate. So there's 10 domains, and domain number 7 really hits upon, the skills needed to participate in health policy. And then we also, next slide, have the ANA Code of Ethics. Provision number 9 is pretty explicit on the role of nurses in health policy. So health policy is important. Again, it's nursing work. However, in my opinion, you can change the slide, that's fine. Thank you. In academia, I typically encounter health policy courses that aren't presented in the best way. They're usually a mandatory class, it's standalone. People hate politics, people don't have time to get involved. Like I said, I teach in the graduate level, so my students are nurses, most of who are working full time and, doing their APRN masters or masters in education and leadership. So these are busy people who have different work and life balance issues in general. So the last thing that they want to do is take a health policy course. However, my perspective on health policy and just the structure of making it mandatory is to try to make it as engaging and inclusive as possible. Next slide. So I decided to create a course that, while textbooks are great, first of all, they're very expensive, and when it comes to health policy, they they get old really quickly. Things are changing faster now than ever, I feel like. And I didn't want students to purchase or rent a textbook, spend that extra money on something that wasn't going to be a useful tool for a very long time. So I integrate articles, podcasts, news stories, different webinars into my course. I understand that people learn in different ways, so I feel like kind of engaging people in those different methods helps them understand the material better and connect with it more. Also, I'm very big on storytelling, and I think podcasts are great for storytelling. For health policy, advocacy work, we tell a lot of nurses to share their stories. They're expert in their stories. And while numbers are important, like statistics and data, it really helps having a face to the name of that data. So helping them connect with the stories behind the people that health policy impacts. And I also want to make it relevant. So as much as I'd love to have all of my students running for office and being involved as much as possible, I strive for the low-hanging fruit. I encourage my students to do tangible things like voting in a school board, election, or just belonging to a professional organization, right? The dues alone help promote policies in an area that we're very fond of. Participating in discussions, something like this, but also work or, at home, talking about the issues that affect us and affect our populations that we care for. And as Grace said earlier, viewing policy work, not just at the state and federal levels, but something easy like the institutional level. It may feel daunting to change things, on the federal level, especially when things are shut down. But, we can make changes just in our own units. So I was fortunate enough to be selected as one of the faculty members to work with Jessica and redesign my course. As much as the content was good, we wanted to make it more engaging. And we also have these new guidelines that Jessica's going to talk about for accessibility. And when we talk about accessibility, it's not just physical, but it's also making sure that neurodiverse individuals are also included when we design these courses.
I just want to say getting Giselle was a real win. Actually getting all of the nurses was a real win. I have colleagues and they're working with like HR people and like business people, and I love you guys. I'm going to miss you guys. Yeah, we're kind of finishing up the course design process, so we can show you a basically finished course. But Giselle has been wonderful. So as Giselle said, the content is excellent. So she is actually hitting a lot of what inclusive design looks like before we even spoke. It was quite easy for me. So we always start kind of backward. It's called backward design, and we start with those learning objectives. So as Giselle mentioned, we're looking at the AACN for nursing and for nursing schools. And that's where we start. What do we want our students to get out of this experience? What do we want these nurses to be able to do skills-wise, thought-wise, knowledge-wise by the end? And so we have a few different approaches. So as Giselle was talking about, like, we want this to be neuro-inclusive. We want this to be accessible for a lot of people. We want this to be engaging. And that's what universal design for learning is. So this is a lot of like the educational component. But basically, UDL is talking about engagement. Like, we have to get our students to understand why they're doing this. And that's where we provide that real world context. And Giselle is actually a master at that. I didn't have to do much to push any of that engagement. So thank you for that. But she has a health policy brief that runs throughout her course where students are actually taking a crack at writing health policy that's meaningful to them. And they have examples throughout, and that's what they're basing it on. They get to revise. And then Giselle added a cool AI memo at the end. So we're integrating like the new technology. And then we have like the content piece. So that's the representation part of UDL. And once again, Giselle has the articles and the readings, but also the podcast, some video. So it's getting to people where they live, right? So if somebody doesn't work really well with reading tons of heavy text, they have the podcast, they have the video, they have other ways to interact and engage. And then there's how students get to kind of show what they have learned, and that's multiple means of expression. So especially in Giselle's course, we have some discussion boards, but it's like, hey, yes, you can write your discussion board, but you can also use voice, you can use video, you can interact in ways that work for you. So I think all of that was an easy lift. Like, I really didn't have to do much to sell Giselle. She was ready to work. So thank you again. We also do strengths-based approach. That's especially important for people with neurodiverse mindsets, right? Like, we're all different in different ways, and that's a strength. Like, we bring something else to the table. So if we look at what are those strengths for those people, that's what we try to do. And then we grow from there. Feedback is about growth. It's not just about this grade. And then we have some transparency in learning and teaching, and that's really just about providing purpose and explaining why. So for a lot of the assignments that Giselle has, we have like purpose statements. Why are you doing this? And that's connected to that real world application. Like, you are busy nurses working in the field, trying to get your master's degree. Why are we having you take your valuable time and do this? And that kind of gets them to understand that, oh, this is the application, this is why. We also kind of look at scaffolding, how can we build? And that's why the health policy brief is broken into chunks. There are opportunities for revision. And then we have organization and findability, which I'll talk more about when I show you Giselle's lovely course. And then we also talk about some active learning. So that's the kind of the modes of engagement, as well as authentic assessment. So we're trying to get them to do things that they would actually end up doing that would serve them in their future. And then we have what I'm really here to talk about. So that's accessibility. So best practices are best practices. Good course design is good course design. And we want our courses to be as usable by everyone as possible. But in the United States, we also have Title II of the ADA, which actually began in 1990. And it's about you can't discriminate against anyone who has a disability. And therefore, we have to put things in place that would ensure that we are not discriminating and providing access. There was a major update starting in April of 2024. And our community has to be prepared for it by April of 2026, so very soon. And basically, we have to follow the WCAG, the Web Content Accessibility Guidelines, at the 2.1 AA level. And basically that just means quite a few things for how we have to set up anything that's online. And we will talk about that. And I can show you some examples as well. I can talk at whatever level you really want me to talk about, because it is kind of technical and some of this might not apply to a lot of you. But this is not just about schools. This is any public entity in the United States. So if you are at a public hospital, so state, federally run, then you also have to abide by the WCAG guidelines. So we kind of want to move away from the medical model of disability. So it's a health condition, there's disease, there's trauma, there's a diagnosis, we have to fix you. And that's kind of what we want to sort of move away from. And we want to move into the whole social model where there are barriers, but that is the context that we've placed it in. And if we can rearrange the way that we organize socially and we organize our systems, we can help remove those barriers. And that's kind of what accessibility does. So accommodations, many of you have probably heard about. So like it's used a lot in schools where, oh yes, you need extra time or you need your test read, but it's also used in the workplace. Like maybe you need flexible time and you need to be at home sometimes. And so accommodations you have to ask for, there's a lot of red tape and you have to keep asking for them. You have to have medical proof and all of that. Accessibility is kind of, we're going to open everything up by design. We're going to make our courses in this case, or our world, or our organization as open and inclusive as possible, so people don't have to constantly ask for and request. And here are kind of our guidelines. So this is digital accessibility. So, I mean, you might be more familiar with accessibility real world. So curb cuts, so that wheelchairs can kind of go up, but hey, they also help if you have a stroller. And then you have the sliding doors. So that can also help if you're carrying a lot of stuff. Or hey, if you have, like arthritis, it helps you too. So for digital accessibility, we kind of go by POUR, which is it's perceivable, operable, understandable, and robust. And perceivable, like, yes, a lot of us can see what we're looking at, but some people cannot. So that's where like alt text comes in. So if I can't actually see what the image is on slides or on a website, we have the alt text. And then we have operable, so I can actually get to places, which is keyboard navigation for some people. And so that's where we have to have like an actual focus within our websites or on our documents or our headings so that I can navigate by keyboard. And then understandable, that helps with color contrast. So if I don't have enough contrast, I can't understand what's happening. And I'll show you something later where it's a little iffy. And then robust. So the more ways that we can have information. So if I do have a podcast or a video, I also have a transcript and captions. And that helps more people access that information. And I know that my colleague who talks about accessibility a lot is always like, hey, captions are great. Like if you can't be listening to something on volume because you have kids or somebody, your spouse is sleeping or something's going on. So I think as it was put in the chat, right, a rising tide lifts all boats. And that's really what we want to do here. We want everyone to have the kind of access that we hope to have to course material. So for me, as we were going through Giselle's course, and she had all of these links, because she does make it, number one, open educational resources, right? She's making it free and easy for people to gain access to what they need to learn. But I also have to go through and make sure that it is accessible to those digital accessibility standards. So this was the Nurse Policy Entrepreneur Cafe, and this is actually what started all of this. I reached out, and you guys were actually very receptive. So I've sent crazy sounding emails to lots of websites now. And I'm usually like, hey, I'm doing a review for accessibility, and I've noticed like you don't have headings. Could you please add them? And most people never respond back to me. So I don't know if it's a me thing, but the emails are a little crazy. So, but Grace responded back, and we actually got to talking, and we talked about accessibility. We talked about Giselle's course. And so that's kind of what I've been doing with all the resources. I check them. So I check the website, right? And it's usually like the headings, the alt text, the reading order, which is that keyboard I can click through. If they have any tables or forms, if they have any moving material and stuff like that. And then we track what we do with that. And same thing for video and audio. So it's wonderful that Giselle does include the podcasts and the videos. And some places are great about adding their transcripts or their captions. And some places are less good at that. So then we remediate. So I'm going to show you something, and it's going to be jarring for some of you. So when I was playing around with Microsoft, it was like, hey, this would be a great title slide for you. And I mean, yes, it has the brewing, and it's even like chemistry related. And it just keeps going forever and ever. So I get why it wanted that. So something like this, where it starts as soon as we go on. So if you have a website and something starts moving immediately upon clicking on that website, that can actually trigger a seizure for some people. But aside from the seizure problem, it's really distracting. So if you're trying to talk while like somebody else is watching this happen, a lot of our people who are neurodiverse, right? Maybe they have ADHD or they're on the spectrum. They struggle with paying attention to anything you're saying when something like that's happening. Additionally, the white on the very light blue is a color contrast problem. So the only way this passes WCAG is because it's huge. So I made it very, very large. But if it was any smaller, this would not pass contrast. And for some of us, this is fine. Like I can see this totally fine. But for other people, this is not fine. And I don't know that. It's kind of like a you don't know what you don't know. Like I don't know how other people's brains work. And I mean, even last night, we were sitting in a dimly lit room because we were trying to change a light. And so, of course, we turned the power out so my husband would not get electrocuted, which my son thought would have been funny because he would have gone, and Ollie wanted that to happen. But, you know, we had the lights off. Yeah, that's my son. He's 5. So, I mean, not a sociopath, but maybe a sociopath. But yeah, so he was like, I want daddy electrocuted. And I was like, no, we don't. But we were in the dark-ish, but I can see pretty well. But my husband can't see anything in the dark. He apparently has very large pupils. So we don't know that. Like, we don't know how other people can or are perceiving the world around us. And I think that's the important thing for us to remember. So, as I promised, this is Giselle's course, and Giselle can feel free to, chime in at any point during this. But we use a learning management system, especially for our asynchronous courses. Everything has to be online. And that's hard because in a classroom, you can tell when somebody's confused and you can help them. And you can be like, hey, these are the instructions. Anybody have questions? It's harder this way. So we have to lay it out in an organized way where people can find what they're looking for and when they go through that journey. So Giselle mentioned the storytelling. And I think that's what I have tried to do for her course. So I think that was the major change. We're adding some storytelling. But
I just want to add, I forgot to mention that not only are they graduate students, but this is an online asynchronous course. So there's very little opportunity for me to be in front of a classroom or a Zoom and get people talking and engaging. So that was another barrier that we've been trying to break, which I think we're doing a great job at.
Yeah, so I mean, originally, a lot of courses, not just nursing courses, not just Giselle's course, originally it's kind of like, here are the readings, here are the assignments, this is what you do, go. So I think the biggest thing, aside from the accessibility, was that organization and that learning journey. That's what I like to call it. We're trying to lead people through this so they don't have the I don't know what I'm doing or why I'm doing it. And so if you see, if I hover over the picture, I have alt text there that pops up. So this is helpful for anyone who actually cannot perceive the picture, but it's also helpful if my internet's really slow, or if, hey, I'm having a color differential background on my computer. So then basically the way we start is this intro, and that's kind of just good best practice. And this doesn't just have to be for education, but I mean, a lot of nurses educate patients in your daily lives, right? You have to tell people what's going on. So it's kind of like, tell them what you're going to say it, and then say what you've already said, That's kind of what we do here. So we kind of talk about what they're going to do in this module. And then we also talk about what they're going to be required to do. And it's all aligned back to those learning objectives, to those AACN subcompetencies. And as you can see, we have variety, right? We have a couple podcasts, we have some readings, and we have some websites. So some of this would be like those journal articles, but some of them are also websites. And we do have different images as well. So if we go in here, I believe, we have some charts and graphs. Actually, that was to get to know your representatives, which I loved. That was a great addition. So Giselle came up with that. But she added this as we were talking, and now they're actually going to be learning about the representatives, and then part of the reflection later on in this module is that they had to talk about what they would reach out to the representative about. But we also try to add multiple modes. So here we are talking about healthcare and how we spend the most on healthcare, but we are not the healthiest, which is sad. This was a sad reality. I actually did research after I read about this in Giselle's course. So we have some images here to show that. So we're not just talking, we're also giving them detail. And then part of the accessibility for that is that we have a long description. So if anyone can't actually read the chart, see the chart, they can still access all of the materials in that chart through the descriptions there. And then we have what we came here for. So this is the Nurse Policy Entrepreneur page, which is what started all of this, right? And so basically what we like to do is provide that journey. So instead of just having here, read this article, here's the website, we kind of tell them, like, why is all of this important to them? And then we have the article that started this, right? And then we have the Nurse Policy Entrepreneur Cafe. And that's kind of where we went, and that's why I started emailing, and here we are now. I don't know if you guys actually want to look at website accessibility, but I could totally show you some other stuff, but I think that's kind of up to you at this point. But yeah.
So great. I love how when we were chatting about this and how the idea was brewing to bring you in and to discuss this and present on it, I love how it captures so many important parts of what we do here at the NPE Cafe and community. It highlights nurses' insights, right? Not only are we extremely diverse as the largest global constituent profession, but we also take care of really diverse patients and people. So our insights working on those front lines mean that we understand what others go through without going through them ourselves. We have that empathy. And so that's really a great insight that we can bring to policy spaces where others may not see them, that are not healthcare providers who are designing healthcare policy, but don't have all those insights to know why we need these accommodations, whether it's for a physical disability or not. But it always also strives to make the cafe and community itself more accessible, because that's what we want to do here too. We try not to create our own content. We know that there is so much really amazing content already out there, and we just want to make that easier and more accessible to access. We do love sharing open resource and open educational resources. But then also it improves the way that we grow individually as nurse policy entrepreneurs within this cafe, whether we're at a very brand new point and we're just understanding what that means, or we're trying to refine it later on in our careers. But what we're trying to do with the cafe and community is figure out what are the best tools for on-the-go adult learning to be able to use and find these resources without creating that content ourselves. So you give us, Jessica, really great insights as to how to make that more accessible, whether we create our own podcast based off of the information that we have, that we're finding, that we're collecting. And Giselle earlier, like information is coming out and changing faster than we can even put textbooks out. So how do we use AI responsibly to help us navigate all of the stuff that's out there? Because it is overwhelming. Once you open up that, uncover that rock or uncover what's underneath the rock, it's just, there's so much out there. So I love how this pulls everything together. And I'm really excited and interested to hear what others think, if they thought about this before, how it, sparking new ideas or any questions for Jessica and Giselle.
And I just wanted to mention one thing. I've heard this a lot when we were talking about making our courses accessible. Like, well, we're not going to have a blind nurse or a nurse who's hard of hearing, and like they won't be able to do the things that nurses do. Well, first of all, I don't want to be the program that rejected the nurse who overcame all those barriers and said, all these schools rejected me, but this one took a chance on me and had all of that available. So there's that. But then there's also, those temporary needs. And Jessica, I don't remember if this was you or somebody else from your department shared a story about how somebody was skateboarding and they fell and broke both their wrists, and they couldn't type, so they needed all of those accessibility things. And I could totally see somebody falling anywhere and not being able to type or have access of their hands the way you would if you weren't injured. So yeah, there's temporary accommodations, but again, I don't want to be the reason why somebody was turned away from nursing because they didn't have the accessible ways to learn. So.
Agreed. And it's not to say it's not hard. Like, this is a heavy lift for a lot of our educators, and I feel like it's a heavy lift for people in other sectors who this law applies to. I know that people, especially in STEM and engineering, like, they have programs that are not accessible. So a lot of the CAD stuff that people use in engineering, not accessible, but that's what they use in the real world. And they have similar complaints, but they don't have a lot of people saying, but hey, let's work around those or figure out how. And I think that's one of the lovely part about working with you guys, because you've been doing this for so long. We're figuring out how. And I think that that's a very like nurses boots on the ground feel. Like, we will make this work. We just have to sort of see what we can do. And I would say other departments are definitely struggling with that mentality. So it's been a pleasure.
Jessica alluded a little bit to something we're working on with this new edition of the course, that we're integrating AI. So for the health policy brief, they just do context and importance of the issue and health policy recommendations. So they like brainstorm different recommendations in their groups, and then they're going to take that information and use it in either Gemini or Copilot, which we have the Stony Brook sign-in version of it, so it doesn't take that data and learn from it like if you were just using ChatGPT, so it's somewhat protected. But they take those two components that they've been working on this semester, and they put in a prompt to write a health policy memo. And really the goal is for, once I like review it, to encourage them to actually submit it to assembly person or a state senator that they were targeting, because the goal is to target somebody for this health policy memo in general. So I'll check it over for content and correctness, but again, having this like tangible item. I think writing papers is great, but again, for like master's students who are working full-time as nurses and balancing families, it could be really difficult. And just the idea of writing an article could be very scary at that level. So I think this is a good way to introduce them into doing something to reach out and encourage health policy changes.
I like that we're sharing and talking about how we're doing the same thing, but in different ways, right? Like, so we take the same concept, same focus, same topic, but we're writing papers, we're doing podcasts, we're doing AI prompts for legislative audiences. And I think that is what keeps adult learning at all levels really engaging, because we also have nurses that are like spanning every generation, right? So we have nurses coming in, Gen Z, maybe Gen Alpha, I don't know if we're there yet. We also talked about retired nurses and having time to engage. And I think it's important to be able to change how we learn and change the availability of different learning tools that can span all of that. And I think that's coming, whether like the changes we like them or not, but we have to be able to incorporate and accept and adapt along with them all.
No, I agree, and like there's cognitive theory of multimedia learning as well. So you don't want pictures that distract from the content, because then you're not helping the processing of all of that and helping it get consolidated into memory. And so there is a lot of theory behind why you don't, but yes, we do love the pictures. I actually originally had a very bright and colorful, like red and orange design that I was very happy that I wanted to use it. But I was like, no, that's pretty distracting for other people. And I think, as like Nina pointed out, like that's the biggest thing. Like in a lot of my high school experience, like I got stuff, and it was easy, and like other people would struggle, and I was always kind of like, what is happening in their brains that like this is not just like, let's go, people. And then I took an organic chemistry class in college, and I was like, I have no idea what's going on. And like I can memorize like the different things, but I do not understand why different molecules become different molecules. I don't get it. And that was, I think, the first time that my mind was open to, oh, I understand why like certain things are hard for certain people. And I think that was actually what drove me to teaching and like all of this educational stuff, because I got it. And I was like, yes, now I understand better like where people are struggling and hopefully where I can help them. And I think that's part of the neuroinclusion, as well as the inclusion of people with disabilities. Like we need to look at, hey, I might have this easy, right? I might be able to move through this world in ways that are not restricted, or maybe only restricted in certain places. But there are other people who move through this world in very different ways, and it's a lot less inviting for them. And I think that seeing that and understanding that, like, that has really made most of the difference for me. And that's why I kind of love this work that I get to do. So not only do I get to work with cool people like Giselle and design courses and learn things about a bunch of subjects, but I'm really appreciating like the accessibility and inclusivity journey that I'm going on. And hey, like my kid has speech issues. So like he had hearing issues for a bit. We got tubes. He currently is in speech therapy, and I watch him move through the world, and I watch him, like, sometimes people won't listen to him because, you know, he'll say something and you won't understand him right away. And then he will not want to talk anymore. And that breaks my heart because his voice is important, you know, and his ideas are important. And so I think seeing things in those different ways and having those experiences and having kids who are neurodiverse or having grandkids who are neurodiverse, you know, that makes all the difference. And the more people who see that in their lives and take that into consideration, I think the world's going to be better for it. I'm going to suggest, so people use different resources, but if you are going to have slides, I'm going to suggest you use Microsoft PowerPoint. I don't have any affiliation, but they do have a Microsoft accessibility checker. So I'm actually I'll share for a brief second and I'll show you where that is. But if you come up along the top bar where it says review, you can then go right over here to say check accessibility, and it'll pop up with the accessibility check over on the side. And that will catch a bunch of the issues. And then for some things you do need to manually review. So the check reading order is, do I have like the title in the right spot for me? And in this case, yes, like would this make sense? And that will help the screen reader make sense of it. But it'll catch if like your images are missing alt text. So for example, like these are screenshots. So these have alt text. And so if I kind of check in, like I do have, like this is a screenshot of XYZ. So I would, number one, that's my first suggestion for anything that you're doing slides wise, use Microsoft Office and use the accessibility checker. I would also suggest that for like Microsoft Word docs and stuff like that. I will say that, shameless plug, I guess, but our Center for Excellence in Learning and Teaching, so that's where I work as an instructional designer, we have a bunch of accessibility guides. And I mean, they don't cost anything, so anybody can use them. But basically, we're trying to get the word out to most of our instructors, our faculty, our staff, and all of those people. But we do have ones on PowerPoints. We do have ones on presentations. And I think for presentations, so if you are using Zoom, you can turn on auto captioning, and that enables it for people who need it. If you're doing live presentations, you could also include that. So you can have the Zoom on and it'll put the captions on. Also, Microsoft has captioning features for presentations. So if you turn on like the presentation mode and you turn on like the subtitles and the captions, it will do that for you as well. So I think being aware of that, using microphones whenever possible is also a very good call. And then I think like if you have the slides, make them perceivable. So as much as you might want to make them very pretty, I would say rein that in. Less is pretty much more at this point. Make sure the color contrast is on point, stuff like that. And then, like I said, Microsoft likes to suggest really cool things that a lot of us would be like, that is awesome. I love it so much, because I do. But I would say stay away from a lot of those because they're distracting. And then for a lot of our presentations, so like we have a symposium coming up. Before we have that symposium, like part of our registration form is, do you have any accessibility issues that you need help with? I mean, we also ask like the dietary gluten stuff as well, you know, but we ask, you know, do you need anything for audio or for visual? I know we have one person where we have a few, like we have games out of our symposium. So we're going to have our staff be able to be sort of readers because he has very low level of vision. And so we'll need somebody to read to him. So asking these questions in advance is also really helpful. And then just being as cognizant of what you're doing to provide for. I think those are my best advice. But yes, and Grace shared our website. But if you look under like the design and teach section, and there's accessibility. So you can look at a bunch of different accessibility guides. Like we have everything in there from Microsoft to Google, from, you know. Website accessibility is a lot because there's underlying code that I don't know. I know how to recognize it because there are tools to recognize it. And that's how like I can tell if a website has stuff like headings. So they're called bookmark lists. I mean, I can show you that as well. So these are bookmark lists, and I find this to be the easiest way to double check for internet accessibility. And basically if you just take one, so if I take the headings one and I put it in my bookmarks bar, and then whenever I go to a website, all I have to do is click on it. and hopefully, da-da-da. And so if you click on it, it pops up. So I keep them in my little folder because I like my bookmarks bar. I put lots of stuff up there. So I have a little accessibility folder where I keep all of them. So you could keep them in a folder, and then same deal. All I have to do is click on it. So I just click, stuff pops up. And so very easy, like I don't have to do anything except for look. And then I just double check like what's there and what's not. And for us, like the big thing would be the headings. The images have alt text. And then there's this thing called forced focus. So if I click on that and then I start tabbing, if you notice, like the New York State is a little bit green around the edge. And then if I hit tab, it'll show orange into all of the places that if I use a keyboard for navigation, this would be the keyboard navigation that I follow. And then that tells me that, okay, if I can only use a keyboard, I can still access all of the links that I could be able to click if I was able to use a mouse. And so then it goes down to like aging, and you'll see it hit the picture and then the link over here so that I could get to where I needed to get to if I needed to just use a keyboard. And if we don't actually have forced focus, that becomes a problem for keyboard users because then they can't interact with your website. Like it becomes no longer operable for them. So we look at those headings, we look at the focus, we look at the images, we look at the language. So if you notice, this has English on display. So screen readers, generally a lot of them are programmed to read in English, especially because like if they're in New York and the United States, like that's what they're programmed for. But if you don't have it set, it might read things like weirdly or have weird accents, as like, so especially if you're going into a different language. So as Angelique mentioned, like, you know, she has materials in different languages for the different populations in New York. It would be helpful if like it was coded for Spanish if it was in Spanish, or else it's going to read things with an American accent, which I mean, strange, kind of funny, but stuff like that. And so we look at that as well. And then beyond that, we look at tables, forms, and lists to see if they're coded. I will say that tables are notoriously difficult, accessibility-wise, especially complex tables. So really, if you have tables at all, like if you really need a table, you want them to be like one row with like nothing split, and you don't want like multiple different things. We have to actually change the nursing syllabus chart because they have like the AACN chart, and they had a bunch of like split cells, and screen readers can't get into those at all. Like it'll just cause massive error. So if you can stay away from tables, that's wonderful. Stay away from tables. If not, you want them to be sort of simple tables, like one-to-one comparison, so that you don't have those split rows. But this will check your tables, and it'll talk about like if it has a table heading, so you need the heading. If it has table data in there, this website does not have any tables on it, but it'll also check for like forms and lists. So like the list, just code it, and like you'll see like this is in a list code. So like if you have a screen reader, you can go through, okay, this is step 1 of the list, step 2 of the list, step 3 of the list. And it just makes it easier for people to read and see. And then if you want to get back to like normal looking website, you just reload it and it'll come back to normal looking. Sometimes I do that in between because sometimes it's hard to see all of the yellow at the same time and determine which yellow I'm currently looking at. So those are my best tips for figuring that out. But yeah, basically you just go to that Bookmarklets website and just drag each of the ones that you really pay attention to. And like I said, we mostly focus on images, forms, headings, tables, and then the language and the lists and the forced focus. And like those are the big ones. Those are your like AA accessibility wise focus. But yeah.
That is
And
literally hiding in plain sight.
I just wanted to add the Microsoft Office tools. Again, I don't get paid for say, I mean, I fight with Office all the time too. But when it comes to accessibility for somebody who didn't come from that space and who wasn't taught to use that, it makes it a lot clearer. It's not perfect. There's things it's going to miss, and there's things it's not going to understand. But all of the Microsoft tools, like even for PowerPoint presentations, you had mentioned that before, Angelique. And if you have videos, there's a way to just add the subtitles to it fairly easily. And you just have to go through the transcript and make sure that it's all spelled correctly. But it isn't that difficult to do with the Microsoft products. They definitely give you a lot of tools there to help you make things more accessible.
I think it gets better too, like as you know more. So like before I took this job, I was definitely not using headings and all that. Cause like even like in Microsoft Word, you know, you can set things to headings. So we talk a lot about don't just make things big. like making something big is not a heading. Like you have to internally code it as such, but really it's just like you highlight it and you make it heading 1. And then you highlight the next one, you make it heading 2. But I was not doing that before. So that was not a part of my natural workflow. But now like I've learned it. And at first it was like, okay, I have to like remember and do all that. But now even like my personal notes, I make headings because it's just part of the workflow now. So I think like you have to give yourself a learning curve and know it's going to take a little more time, and then it gets better. And same deal for like captions and transcripts, you know, like it's not quick, but it's not necessarily like too difficult. You know, you just have to go through and double check and add things in. And I think like part of the way I deal with that is like, it's worth it, you know, like I think about my kid, I think about the students I used to have, I think about how I would want people to put in that little extra effort to do that for them and for him. And that's kind of what makes it less, you know, a time suck and more something that, you know, it's a labor of love.
It is. And it's just something that, you know, when you first set it up, you do, but then once you're updating it, it's already there. The bones are there, so it doesn't require that much upkeep. I also use the headings in my own work for myself now too. It's just nice to collapse certain sections, and when you're working on a large document or get the table of contents fairly easy. So yeah, I really started adapting it into my own use as well.
This has been an amazing session that's spanned so many good topics and the intersection of them all.
Yeah, this is awesome. Thank you so much.
Like I said, nurses are great. It was a pleasure hanging out with more of you. I'm going to be really sad in like a week or two when I don't get to have my nursing meetings every week.
Just come to here every month.
Yeah,
Come join the cafe. Yeah.
Yeah. It was a
Thank
pleasure.
You.
Bye-bye.
Have a great one.
Bye.
Thank you so much. Bye.